Thanks.
Okay. So, hello, everybody.
Good morning.
Good morning.
Welcome to our today's version of Proactive Health Collective of Keene. Those of you who are used to viewing us and tuning in understand that we are a group of holistic health practitioners. I say that, I mean, we're a group of healthcare practitioners, and I won't group that under any kind of thing, but we are of the conviction that good health is kind of a right and is available to us if we know how to support our bodies and our brains, well, everything about us in ways that support the body's natural movement towards homeostasis, healing, towards balance, and being well. And we just all come at it from a little bit of a different perspective. I have Dr. Gene Clerkin right here is being seen with me. He is Monadnock, come on.
Natural health.
Natural health. And tell your background a little bit, Gene. Kind of where your focus is. Yeah.
Sure. Well, I'm degreed in chiropractic, and a lot like Dr. Tisabitelli, I've practiced network spinal analysis for many years, but also, due to some of my own challenges, I've gotten into some kinesiology-based nutrition and really work more from a holistic viewpoint. So we do wellness programs where we do focus on many different things, because I've just found that more bases that you cover, the better chance you have of having success. So a little bit of different experience in different areas, and certainly with my own personal experience.
Yeah. And then Tisabitelli, Dr. Tisabitelli is also with us, so she can hear us. And there she is with River.
Hey, River.
River. And my goodness, River, you are growing up. Look at you.
This is River. We are 6 months old now.
Wow.
Hey.
So big. We are practitioners of life, creating life. Hey, Allison.
Hey,
Wonderful,
Even
wonderful.
River's excited.
hi, River.
And I know, it's so fun.
He's got the best hair.
He does. I mean, wow, what a beautiful boy. And it's
That's
great
what
to
my
see.
hair looked like on the way out. His is on the way in.
On the way in.
I love it. I love it. I love it.
Every which way.
So anyway, so we're just talking about kind of our different ways we come at things, in our group. And so Allison, just give us a little, what you do and what your approach is and that kind of thing.
Yeah, my name's Allison Milar. I'm a licensed acupuncturist, and I run a healing arts clinic in Keene, New Hampshire, based on Asian modalities like acupuncture and 5 different branches of Chinese medicine. And we look at the body, like all of us, in a very holistic way. So we can use methods of diagnosis like questions and pulse and looking at your tongue to figure out where there might be disharmonies or imbalances in your different organ systems. And then we just work to correct those underlying imbalances. And you may or may not have symptoms, even if you do have these underlying imbalances. So you can, strength of Chinese medicine is really treating preventatively. You can diagnose things before they even manifest as symptoms.
Yeah.
So really optimizing the health of the body and making it run more efficiently and effectively, getting all the lines of communication open, the circulation improved, and everything harmonized. Yeah.
Wonderful. And now Dr. Tisabitelli is representing the Abitellis, both her husband Matt and River, and so yeah. So tell us about Cheshire Wellness. Tell us about what you do, and just give us a blurb.
Thank you. So it's been a minute since I've been on here, so excited to be back. Just new mom, so life's a little crazy. So Cheshire Wellness Center, we specialize in a very light touch chiropractic approach that Becky and Dr. Jean have just briefly mentioned, network spinal analysis. It's about life. And, it's funny with everything going on about, being a healthcare worker. And I honestly think that we're wellness workers. We're not healthcare workers. We're wellness workers. And I want to change my title to that. I don't know if that's official or not, but that's how I feel. And
I'll sign the petition. I'll sign it.
Yeah, get it going. And so it's working with the body, and definitely just in my personal experience, connection where tension is held and bound, and how it creates, said symptoms that arise in people's body, whether it's pain, whether it's an emotional disconnection, or even just from a physical trauma. There's tension in the brain and the spinal cord that affects your body overall. And we work with releasing that tension within the body. And like Allison says, it's about preventative work. It's not about fixing anything or, making something wrong. It's about actually liberating the energy within the body and opening up the system to something new and possible. And I think how we work together, the four of our businesses together, really hone in on that, instead of you're broken, I'm going to try and fix you. And that's really not the case for anybody. So we focus on that through a very light touch chiropractic approach, and super fun and great results.
It's funny that you say the word health, you don't like that. If you really understand the definition of health, we are really that, but it's been co-opted or taken over by the disease care system.
Right.
And they call it healthcare system. So I think that's kind of probably what you're saying, right?
Yeah.
And wellness is sort of another way of describe it, but health would include wellness and mental, emotional, and, biochemical and social circles and all of the different things that make up your experience. But it's interesting. You have to keep changing definitions. Okay, no, we're not that anymore. We're over here. When are they going to come after that word, wellness? They have actually, they call wellness, screenings for cancer. And I'm not saying there's anything wrong for screenings with cancer, but that's not really wellness. That's looking for disease.
That's early detection. So I always tell people that's not, mammograms are not cancer prevention. They're early detection, and they're dangerous in their own right. But don't say that this is how you prevent breast cancer. Ask your person when they come to you for their annual, are you getting iodine every day, right? Because that's breast cancer prevention. Are you doing things that are actually breast cancer prevention? Or are we just going to go in there and find out early that you have a disease that was preventable, and now we're going to treat it? So I think that's been a big disconnect. And I also, with Dr. Jean mentioning, and starting with Tisa, the labels and things, we've been called complementary, right? Complementary, because we are not the AMA. We are not representing the AMA, legal healthcare system in the United States. So we're alternative and we're complementary. So I would always, if we wanted to get into a thing, I would just reject those as well. I think that those are patronizing kind of designations that we can kind of come alongside the real stuff, maybe.
It's funny.
It's okay if you
that.
use these services, but as long as you have the real healthcare, then you can use these complementary alternative
on the
things
side.
on the side if your doctor says it's okay.
Well, how about changing it to, we are an alternate form of healthcare, not an alternative, not a complementary. We are an alternate. We are.
How about a superior?
I like that.
AMA probably wouldn't.
Superior.
Logical, superior,
Yeah.
We're above the rest. Yeah.
All right. Do you guys think I should bounce off here for a moment and see if I can figure out how to stream this to Facebook, or what do you think?
Sure. Why don't you do that so we can get that going to our Facebook pages?
All right. So what I want to do is I first want to introduce the topic and just say we were talking about neuropathy. And a lot of people have problems with neuropathy. In our group right here, I think we all have something different to add to that difficult conversation. So I'm just going to take myself off video for a moment. I think I can get myself back on. Okay.
Yeah.
And see if I can figure out what to do here.
All right.
Neuropathy just means pain of the nerve. So it's it's so broad. It encompasses so many things. It could be the kind of neuropathy I think that pops into people's minds right away is like your feet, like diabetic neuropathy, especially where you have problems with sensitivity. But it could be like neuropathy with nerve pain if your vertebrae is out of whack and it's pressing on your sciatic nerve, for example, and you get nerve pain down the back of your leg. Or some people come in and they just have tingly sensations in their arms or their fingers. So that's also a type of neuropathy. So there's, yeah, the first thing to note is that it's a pretty broad field.
You'll have to give me.
Hold on, Becky, mute yourself.
Oh.
Becky, can you hear us? Mute yourself.
I'm here, but wait a minute. Oh, sorry.
Mute yourself.
All right, hang on.
What about my keys?
Can we mute?
Sorry, Dale just showed up, so I'm trying to get him on board here. Okay, so how do I mute myself? I can't find myself. Okay, I'm
No,
here.
I can't.
Maybe you need to take a few weeks and go find yourself.
Okay, she's muted now. Go ahead, Allison.
It's a very broad thing to treat. It can manifest a lot of different ways. And I think that's true in the treatment process, at least through my scope of medicine, is that you got to figure out where it's coming from, how the person's presenting, what specific types of imbalances they're having in their system. I think there's generally some heavy hitting things you always have to treat in terms of just increasing circulation, getting the blood moving. But different organ systems have different activities with that as well. Is the problem that their digestive system's so weak that they're not absorbing the nutrients from their food, so they don't have the building blocks to make the volume of blood? That would be the way we approach it with Chinese medicine. That would be we treat it like the spleen and the stomach meridians. Or is the problem more like the fire of the body, the metabolism and the circulation, the kidney yang isn't strong enough? So that could be another component. Or maybe it's the liver. The liver's like the main mover of the chi of the body, of the energy of the body. So maybe the energy is not strong enough to move the blood. So there's a lot of different ways to treat it. So the blood and the chi or the energy move in the pathways together. So it could be that the chi is not strong enough to move the blood, or that there's not a volume of blood, or that the blood itself is stuck. But anyways, point being, there's so many different ways to come about it and different ways it could present. So yeah.
No,
Yeah,
that's
you know,
cool.
I think that, in using kinesiology, it's actually, my understanding is based off acupuncture and energy channels, right? And do you check the pulse, Allison, for that? So the muscle test really is this, you're checking the same system. One of the things I like about it is it allows us to kind of go in. And what I found is that in the body, one thing can lead to another, can lead to another, can lead to another. And so to the best of your ability, you want to try to get to root cause. I mean, root cause can go far beyond maybe even your ability to detect, but in the body, you want to go to root cause. And so you could have an organ stress that causes, a spinal distortion, which then causes nerve pain, or it can go the other way around. So just kind of interesting thing is you're saying, hey, it could be a lot of different things involved there, and a lot of different systems.
Yeah.
Yeah.
It speaks to the strength of our medicines that we have these ways to diagnose that are more holistic, and they encompass a lot of different organ systems, and we can figure out a lot more specifically where something might be coming from to treat it, as opposed to maybe just putting
Off a nerve or obliterating it.
As opposed to covering it up, finding root cause. So there's, I would imagine, like what I've seen, Becky can probably speak to this, there could be nutritional, deficiencies that lead to a neuropathy, as you mentioned earlier, Allison. There can be, something like diabetes, which, is really, it's about the pancreas, but it's really a systemic thing anyway. Tisha, you want to talk about a little bit from the chiropractic perspective on that?
Yeah.
Or I could jump in, honestly, I could jump in right
Or
there.
Becky.
Becky, go.
Well,
Please.
Well, because you mentioned the diabetes, right? So I just want to say why we have diabetic neuropathy is a process called glycation. and that's a binding of sugar to protein. And I describe to people, when you put a turkey in the oven on Thanksgiving and the skin gets so delicious, very sticky, sweet, yummy, right? I love eating that skin, but that's called age-related glycation end products, AGEs, and these are very damaging to the body. And people who are diabetic, they have so much glucose, so much sugar in their blood that they can't get rid of. And it's going throughout everywhere. And when that happens, it gets into the small little nerve endings and things. It gets into the little glomeruli of the, whatever, however you pronounce that, of the kidneys. It gets into the retina of the eyes. And this is why diabetics have, it's the exact same etiology, and etiology means cause. It's the exact same process going on that damages these organs. So why do diabetics have neuropathy? Why do diabetics have kidney damage? Why do diabetics have eye problems? It's the same process. And so there are things that I use, and again, I love the panel because this is it's not all the same thing, but nutrients that help with that. There's a fat-soluble form of thiamine, vitamin B1, called benfotiamine, and it stops the glycation process. That's how it works. It works well for diabetic neuropathy. I mean, it's not like the be all and end all. Hey, you've got this diabetic neuropathy, so just take some benfotiamine and woof, poof, there it goes. But it can be really helpful. And it's also been found to be very helpful for neuropathies due to other things such as sciatica or things like that. So my approach, and I'm a nutritionist, and so I tend to look at what are the nutrients, what are the things we can do that strengthen nerve health, such as vitamin B6 in activated form, P5P, also B12, benfotiamine, things like that. So that's kind of my approach when it comes to that. Anyway, so I just wanted to.
So Becky, would it be safe to say that if you're lacking in these nutrients, that might make you more, have a propensity towards having an issue based on other stresses, either physical stresses or otherwise? In other words, if you're nutrient deficient, especially, in this topic regarding the nerve system, is that going to make you more vulnerable to structural issues? In other words, if someone has a structural issue, if they're more deficient, they could be more likely to have nerve pain.
Yeah, absolutely.
Yeah.
Cool.
Yeah.
So that plays into the chiropractic realm, right? So, helping the restoration of the nervous system, having ease, and that over time is going to create tension, when someone has either a bone out of place and that nerve is not going to wherever it needs to go to produce the correct enzymes and the correct hormones to help balance whatever's going on. And then of course, add insult to diet, like we were talking, the diabetes is a very common one, the diet, the high sugar, the carbs, all that stuff, the body's not getting the nutrients. So releasing tension in the nervous system, helping the bones go back into place, and just having a clearer signal from brain to body, you're going to function better anyway. And then adding the supportive nutrients and diet, which is why, diabetics, get kind of a bad rap with their diet, with what they could eat and how they eat it and when they eat it and all that. And it does suck, but a kidney diet is even worse. Like if you have kidney issues, it's like a completely bland diet because the body just can't handle anything. And so having a connection piece with the whole body, brain, body, organ systems, and then the supplemental nutrition to help someone get more out of what they're eating. And then adding to the psychiatric problems, the issues with people like, oh my gosh, I'm diabetic, and like associating their life around being diabetic. Well, it can be reversed. If you change your diet, if you change your habits, anything can shift. It's just how willing are you to really make that change? And it's all.
I think it's so wonderful I do a radio show every Saturday. I've been doing it for years, for maybe 6 years now. And Forrest Sundstrom, he doesn't mind me saying this because he's talked about it on his own radio show, has been my producer all this time. And he found out, I don't know, maybe 6 or 7 months ago that he was type 2 diabetic. And he just, he took the bull by the horns. He was like, I am not having this. Now, my daughter, who hasn't seen him in a couple of years, was my guest in the studio a couple of weeks ago. And we left the studio, and the first thing she said was, Forrest looks amazing. So she had not seen him in 2 years, right? What did he do? He changed his diet immediately. He started working out. He did some supplements, but he owned it. And it was so interesting because I told him, she said, I didn't want to say anything to him because I know when people say to me like, oh, you look so great, I'm thinking, what did they think I looked like before? So it's like, you don't want to say to somebody, oh, it looks like you lost weight, right? Because then you're almost saying you looked fat before, that kind of thing. So you don't want to necessarily kind of like, are careful about what you say. But she could not get over it. We got out of the studio. She said it many times. I can't believe the difference in him. And he just did this himself. So don't think that if you're type 2 diabetic, that you've crossed a bridge that you cannot go back across and change. His HbA1c came down from, if anybody knows anything about those numbers, that's a hemoglobin valuation of your average blood sugar levels over 3 months' time in the hemoglobin. And so you're supposed to not be above 6, 7 tops. He was at 11 something. And in I think 3 months, he was down to 7 something. And we're waiting to see again what happens. But, he is a great example of a person just saying, I'm not going to go down this road. I'm not going to accept this diagnosis and just go on these medications and assume that that's it. And a beautiful example of transformation, and really just by saying, I'm not having this and I'm going to be disciplined. Yeah.
And imagine how much better he feels too. If he is vibrating that on the outside, imagine just the amount of more energy he has access to in order to apply however he wants, starting new ventures or creative things or hobbies, and probably sleeping a lot better.
He's brilliant. He's the most amazing artist. When we're in the studio, he does a lot of sketching and cartooning and stuff. He's like, but I agree. When you have those things off you, you have all of these new opportunities on you that are just, what does good health support in my life?
Yeah. When you have the resources and the building blocks, it opens so many more doors in different areas of your life because you now have the energy for that.
Yeah.
Yeah. Everybody here. Go ahead. Please.
Go ahead.
I was just gonna say, I think an important theme here related to what we're talking about is that I think people get tagged with a diagnosis and they feel a little bit powerless. Like, oh, this is what I got now. And
what I am.
And this is what my parents had it. So this is what I got. And I guess, my doctors say there's nothing I can do. And the truth is, that's not true. We can be empowered, and something as simple as changing the diet is going to make a huge difference no matter what condition you have. But there's also so many other resources for people to overcome these tags that they get. And I just think that's important. I think that's the whole, in my eyes, the whole point of this group is to let people know, like, hey, there's stuff you can do. You don't have to be sentenced, so to speak, to a diagnosis.
Yeah.
That's exactly what I was going to say.
No.
Just because it's, everybody wants to say, well, my story is this, and be like, okay, that's a great story. It doesn't sound all positive. How would you like to change that story? And it's changing the mindset behind it. Like, just there's a difference between hereditary and genetic disorders, and hereditary is usually an environmental passing down. Like if your grandparents ate really terribly and then your parents ate really terribly, you're more likely, because you were in the same environment, to eat terribly. Therefore, you have the likelihood of getting the diagnosis, the diabetes, the heart disease, the lung concern, whatever it may be. You said diagnosis, right? Because you're following that
Yeah.
pattern that you were taught.
That's such a good point. I've never thought about that before.
Yeah.
That's a great distinction. Yes.
Yeah, but you can change that, because so many people, well, my parents have it or my siblings have it, so I'm gonna have it. Be like, not necessarily. I got told that so many times. My sister, you know, everybody means goodwill, right? My sister was like, you just better be ready to have your child 6 weeks early, because you and I were 6 weeks early, my kids were 6 weeks early, and your kid's gonna be 6 weeks early. And I'm like, that's not my story. I'm not going to stick with that story. And he was half a week early, you know, like he was in there all the way up to 39 and a half weeks. So
He was right on time.
He was right on time. I mean, and
He
even
was right
6
on
weeks,
time.
even 6 weeks is right on time. You know, I was like, I'm just not going to follow that, because I'm not worried about that. You know, I feel like it's going to be just fine. I just didn't fall into the story that someone else had. And so anybody can do that, but it is really, really challenging when the people around you believe that believe whatever story is going on very strongly. And like your vibe attracts your tribe. And if your tribe is telling you this is how it's going to be, you're more likely to believe that. And it's really, really hard to break out of that mindset. So it is possible, though.
As you say this, I think of like this global thing going on in the world, you know, the vibe and the tribe. It's hard to break out of, right?
Yeah.
There's both light and dark right now. And the darker the dark gets, the lighter the light is going to get. And we'll see what happens, right?
I think another cool thing that neuropathy has to teach us is, or how so clearly teaches us, is that the problem or the area of your body that's speaking the loudest to you is not necessarily the area that you need to address, right? The nervous system is pretty complex, and you can feel something in an area of the body where the problem is not at all. Like, for example, with neuropathy, you know, you could easily see how that could happen. You know, you could have an impingement in the cervical vertebra, but you don't feel anything there, you feel it in your arm. So I think that's a really nice point to make when we're talking about this topic.
Yeah, because where does everybody focus on? Like the healthcare system or the sick care system, where do they focus? They focus on where it hurts and where it's not working. Right?
But even anatomically, like, yeah, what Allison was just saying, yeah, you think, oh my goodness, I have this pain down my leg. But it's not your leg is not the problem. It could be your sciatic, you know, you guys know that better than I do. It can be your sciatic nerve, you know, nerve.
The sacrum, the lumbar.
It can be something else. It could be something that's being impinged, like Allison was just saying, you've got something up here, but you think the problem's down here.
Yeah.
You think the problem's here. And so you think, what do I do for this? So I think when we talk about the nervous system, and everybody here, all of you three, and Matt included, deal with that, getting things to flow properly, getting the nervous system, the central nervous system to flow, and opening up those blockages. That's how I understand it. Opening up the things that block the flow. If you all of a sudden you're trying to get somewhere and you're in a traffic jam, suppose you're trying to get water to a fire and you can't get it there, right? The fire's over here, but the water can't get there to put the fire out. That's kind of how I think of that.
Yeah. It's a really clear example with neuropathy, but it's true in things that you wouldn't, you know, even if it feels so clearly to you, like the pain is in the upper left back. There's different manual therapies you can do.
We changed.
You know what? My photo.
Where'd you go? Is someone
studio is right here,
else
believe it
talking?
or not.
Oh, Dale's.
It's
Oh,
Dale.
it's Dale.
Then all the cream
Yeah,
making is
yeah.
done over here. I got 4 dispensers
Oh,
there,
darn, hang on.
and all the
Our
new,
tech guy.
all the
Hey,
new.
Dale, you want to mute yourself?
He's in the other room, isn't he?
It's very classy.
Yeah.
We mute him?
All new.
I'll go down and tell him, sorry.
Yeah.
That's
Just thought you'd like to see it.
That's so funny. It's our tech day.
You guys can like hear what I'm saying, yeah?
All right.
Well, that's a subluxation right there. When something's trying to communicate and then something else is interfering in it, you're not getting a clear communication. So therefore,
What
the
a
message is
gift.
not getting received.
What a gift that was, because it definitely explains exactly that.
Right, and it was kind of painful, right? And felt like a little neuropathy going on. Right? Yeah.
We picked up that whole conversation on Zoom.
It's really funny. Allison, sorry, did you finish what you were saying?
I was gonna say real quick, you
Yeah.
can you can do different types of manual therapies with Chinese medicine, gua sha and cupping, and you can use them diagnostically to actually see where the stagnation is in the body, because the area of the skin will get red and you'll see where it's not been circulating smoothly. And I always, if someone says like the pain's on the right here, I'll always do the area around and the opposite side. And not all the time, a lot of the times it's right where they feel it, but sometimes, quite often, the area of the stagnation is not in that area. So yeah, it's things are not always as they seem.
We were talking about the nerve system and nerve pain, and from the network spinal perspective, as I understand it and have practiced it, I describe it to people as like a fishing pole, the fishing line at the end of the day, when you put your hook on one of the loops and then you wind it down and the fishing pole kind of bows. There's this tension that you could imagine these nerves actually being stretched to their ability, and there's something that we call facilitation, or at least we did back in the day, whereas actually it can be an overstimulation of the system. And I think in my experience, when I would do that work, if you take the tension off that, it just as a Dr. Tisa was saying earlier, and you just bring some more ease, it's basically like taking tension off that fishing line. And now there's no need for the pain, meaning the pain is there to tell you, hey, this is just not right. Again, I'm not talking about diabetic neuropathy, but I'm talking about from a structural standpoint. And you can take the beta blockers or whatever you do, but then all you're doing is cutting off the signal and not allowing that signal to guide you to what you really need to do, which is take tension off the system.
Isn't that like a Carly Simon song? Am I having a time for Another thing from a nutritional standpoint that I like for neuropathy, and again, what happens to people in the mainstream world when they have neuropathy, right? Neurontin, gabapentin is a drug that they will use to try to help with that nerve pain. And some people, they're in agony, they use it. Gabapentin, though, also just makes you tired, wiped out. Yeah, okay, I don't have so much nerve pain, but I really don't have much get up and go either. I'm just kind of like sort of medicating myself. So I had a man with idiopathic chronic polyneuropathy several years ago. I probably mentioned him before, but he had been bitten by a bat, and then he had to have a series of rabies vaccines. And on his third rabies vaccine of the series, he really suffered what I would describe as Guillain-Barré syndrome. His mitochondrial energy just hit the floor. And now he has this chronic neuropathy throughout his whole entire body. And so I put him on all these supplements and stuff the first month we met. And there's one supplement we use called Gerovital GH3. It is procaine hydrochloride. It has a really interesting background to it. But anyway, I had him on that. I'm not thinking about his neuropathy, but just anti-aging and overall wellness. But you're supposed to take 5 days off in between. You know, you finish a bottle, it's about a month, and then you take 5 days off and then you start another one. And he told me that during the first month when he was doing my protocol, he brought his gabapentin dose down to half. But when he took his 5 days off, he had to raise it again. It was my first clue that procaine hydrochloride, Gerivital GH3 was had, you know, application towards neuropathy. So there are things and that's kind of the way I approach things. Like, I can't do anything about your spine or the things that Allison does or Dr. Jean, but those are kind of the things that I hone in on when somebody has neuropathy. How can we support the system with nutrients and things like that too?
Well, when I hear something like that, like when I'm looking at somebody's history and I'm thinking like, okay, after an assault on his system, what we're talking about here is inflammation. When you've got a systemic thing going on, it's not like one leg or whatever. You're talking about a systemic inflammation. However you slice it, whatever the cause is, you're talking about systemic inflammation.
And we were doing stuff for that. I had him on so many things, but I wasn't thinking about the GH3 as directly influencing that nerve pain. I had him on benfotiamine, like I've talked about before. I had him on, you know, glutathione, systemic inflammation, all of that kind of stuff. And it was just interesting to see when he took a break from that one particular thing, that the neuropathy. So it's always, and exactly as you just said, Dr. Jean, this is how we work. We are basically detectives. That's our work. We sit down and listen to somebody, and whatever different ways we use to gather information, whether it be kinesiology or, you know, whatever. I basically get mine more from listening to people, but we see things that people are really being missed. I had a person this week, and it was probably one of the most profound interactions I've had with a client who's had a horrible, terrible rash since November of last year. And, you know, she's been to 5 dermatologists. She's been to, you know, she also has a very heightened hypertension, but she's not your classic hypertensive person. And her mother had lupus, right? So I look at her rash, I compare it to lupus rash. I look at the risk of recalcitrant to treatment hypertension in people with lupus. Her mother has lupus. Then we look at, I can't go down the whole list, but it was one of these most revelationary things. And I had said to her right at the beginning, I said, do you remember something last November before this all broke out? Were you sick? Did you get a vaccine? No, I didn't get a vaccine. I don't get vaccines. Did you, and then later in the conversation, she said, oh, wait a minute. She goes through her notes. She goes, on November 2nd, I was diagnosed with a urinary tract infection. And I was prescribed, what were you treated with? Bactrim. And then I find it, and this is in scientific literature, that infections can be a trigger right there for a lupus flare, right? But Bactrim, they say never use Bactrim if you have lupus, because it will trigger a lupus flare. So this is the thing, we are detectives. We look at people and we, you know, this is a woman who has been, like a lot of people are very marginalized, especially my dad used to say, the worst thing in your favor going to a doctor is being a woman, but oh, just like eliminate common allergens in your diet. Try this cream. Let's put you on steroids. Let's put you on triamcinolone for this rash. Let's do this. And your high blood pressure and all of this stuff, you just need to calm down. You just really need to calm down. And then you look at this, there are so many more things we pulled together. And it's like, people are so underserved right now, right here and now. They're not getting answers. And I am not, I don't have any medical credentials. I'm a holistic health practitioner with a degree in holistic nutrition. Big whoop. And within 10 minutes, I can look at her and say, wow, I mean, this is just evident what's going on in your system. Yeah.
I think it comes down a lot of it to what we've hit on a lot of the time, or many of these episodes before, is that we just spending the time with people to get this information, and then looking and, you know, Rebecca, you spent so much time researching and learning, and, you know, and you are accepting insurance. You don't have time. You know, I can speak from personal experience. You know, the way it's structured to get paid, you cannot afford to spend much time with a patient.
Yeah, it's exactly.
Because you just don't get paid for it.
Well, yeah.
But they crowd it out, because I have a doctor right here in Keene who's come to me personally for her own stuff. And she's like, I wish I could do what you do. There's no way, right? Because you've got 15 minutes with a person, you know, after they've had their blood pressure done and made sure that we're up to date on our whatever and what the diagnoses are. And we're seeing you about your rash, right? But we're not going to talk about your blood pressure at all, right? Because that's totally different. So we're going to see you about your rash, and then you're going to see somebody about your blood pressure, and then you're going to get a prescription, and we're going to give you this. I'm going to tell you to do these lame things, and never the twain shall meet. Never will these notes come together. Never will anybody look at the person in a big whole picture. And that's the difference between what they're doing and what we're doing, because we are looking at the whole entire person. We're looking at their lifestyle, their diet, what's gone on in their genetic history, with their family history, and all of that. And what is their diet now? What's going on? What are they doing for medications? What are they doing for, this person was also on a drug for the itch, right? So I know this drug, it's hydroxyzine, Atarax. One of the big threats to this drug is suicidal ideation. And you've got a person who's already really depressed and does express to me, yes, that's true. I do have that. And so this is a disaster. We're in a disaster when it comes to actually promoting wellness and wholeness. The good news is that doing the right things, we can't necessarily fix everything, but can we make a huge difference, like a life-changing difference in your quality of life and your health and your ability to resist further disease down the road? Oh yes, and that's what we do.
And that's the challenge, isn't it? Like, that's kind of where, you know, the 21st century healthcare system has led us to outsource our health and not take ownership with what really is the underlying cause, whether it's physical, chemical, or emotional tension. And it's creating whatever's going on in the body, but it's looking to someone else to fix you. You know, it's a therapeutic response. It's like, this hurts, fix this. This is bad, fix this. And again, like Becky, you were saying the example of like not having time to meet with people because insurance doesn't allow, or whatever the story is. Either you're gonna go that route because it's cheaper and easier, or you're gonna do something much more different that you've never thought you'd do before, and actually own up to where you're at and why you're there, and make a change to something different. And so that's where our work comes in, you know, like seeing the person and really understanding, like, because if you fix that one problem, yet you continue to do the same things you've been doing all along, what's the likely outcome?
Yeah, and that's what I always say
back.
when it comes to like modern day cancer treatment. Okay, get rid of the tumor, you know, blast the heck out of your body and your whatever, but we got rid of the tumor. I'm like, if you didn't change the terrain, and now you've weakened yourself so much with this chemical and this horrible treatment, you know, all of that oxidative stress, which we know oxidative stress, free radicals, is the most probably important influence on our health. And that's what chemo and radiation are. And all you did with, we got rid of that tumor. Well, my goodness, if you do not change that terrain, you got cancer coming up the next day. And it's going to be harder to treat. It's going to be harder to do. If you change the terrain, you will cancer-proof yourself. You'll get rid of your cancer. It really helped get rid of your cancer. You'll cancer-proof yourself, and you will proof yourself against a lot of other things just using those same tools. That's where we are. And I think I would guess you guys would all agree with me. It's really wonderful when you get older people who have dealt with things for years and they get results and their lives change because they would think I'm way too past, but I see that. Don't you guys see that?
When I sit down with somebody and we do a consultation, it's about an hour long, sometimes an hour and a half long conversation, and we really dive in deep. And I think, and I lay it out. I mean, I don't sugarcoat stuff for people. It's like, you're going to have to make some changes. If you want to be successful working with us, here's what you're going to have to do. I tell them exactly what they're going to have to do. And they're always, I get this a lot, like, well, I kind of want to do it. Sounds good, but is it going to work? I say, you know what? If you detoxify your body, if you handle your stress, if you get good nutrition, if you handle all these things, it works 100% of the time. 100% of the time, it works. Does it mean it cures everything? Not necessarily. There can be things outside of that. Maybe somebody has a pituitary tumor or something like that, or maybe they're in a relationship that doesn't work or a job that they hate, or there can be other reasons why people have health challenges. But one thing is for certain, there are foundational things that anyone can do for their health, and they work 100% of the time. Like, if you do these things, there's no possibility that your health doesn't improve. It's not possible, right? So, and a vast majority of the time, it means their symptoms shift as well. But I think it all comes down to, like all you just said, it's like, if you don't really have a shift in your perspective in how did we get here in the first place, like the cancer people. I mean, I'm pretty blunt. Like, I was talking to a lady when I had the phone, and she was like, well, I'm basically pretty healthy. I'm just finishing up my I've got I'm still in my cancer things, but my doctors say everything looks pretty good, and I'm basically pretty healthy. I just wonder what you could do. And I'm like, are you kidding me? Like,
You're basically pretty healthy?
there's like, what are you talking about? You got
And I don't have any pain.
Did something change about your health, that would set you up for that in the first place? So I think, there has to be a little bit of reality check sometimes for people.
It sounds like this.
I was just going to encourage people on that point. You don't have to do everything. Do something. You know what I'm saying? If you've got, and you want to go down acupuncture, I mean, amazing. Allison, my daughter, raves about you. It was so interesting because I was talking, oh gosh, was it Jean and I a couple of weeks ago? But anyway, it was Matt and I. We were talking about immunity. And somebody had promoted on that webinar, had promoted this Iome drink. It's like a mineral drink. And it was so interesting because I was very interested about that. And I said, oh my goodness, that's something I'm going to want to stock. That makes so much sense. And I don't have anything that really does that. And then Krista said to me, no, that's what I got from Allison. And I left it at your house when I was here the last time. And I was like, yep, that makes sense. So there's a lot of overlap in different things, but I think it's really important to know that you don't have to do everything, but you need to do something to get things kicking up in what your body already craves and will be responsive to is things that get things moving, whether it's nutrients or whether it's getting that flow of the central nervous system, which both chiropractic and spinal network and acupuncture do, and all of that, finding out, what's going on with you, what things might be a trigger for you that you don't even know, that sensitive to something through kinesiology or what is actually going on in finding those things out. And, you know, once you have that kind of information, you feel so free. You feel so like you can just ditch. You always want a good medical practitioner. And this one practitioner, I won't mention her name, but 2 people this week mentioned her to me. She's a doctor, but she's totally online. And somebody said, I need to ask Rebecca Montron about this. And she goes, yes, absolutely, go do that. I'm not giving it I'm just saying there are good doctors out there, and there's a place for a doctor, for somebody who can do things that we can't do. And if you can get a good little bit of a team of people there for you, the sky's the limit, and you'd be super, super surprised, no matter how far gone you think you are.
Yeah, I think the solution is collaboration. Just like this is a collective of practitioners who are like-minded, we need to get in together with the medical community. They're not wrong. Their work is not invaluable. It's very valuable. Medicine is necessary when necessary, by all means. It's just the context in which it's given and the lack of respect of viewing the whole body. So there are practitioners who are out there. I don't know if you guys are familiar. I think you are, with Zach Bush. Dr. Zach Bush is an MD. He's like the most holistic, body-centered practitioner I've ever heard of. And I'm like, that's great. And I know there are practitioners here in Keene who do see the person as a person, whether they take insurance or not, it doesn't matter, but we need to collect with them and really collaborate.
Can I dive in on that? Because that is Monarcha Health right here on West Street in Keene. I had a good conversation with Aurora Leon, who's one of the doctors there. This is direct primary care. They they're more functional medicine, they're internal medicine specialists, right? But so they see people 16 years old and older. It is kind of like more a concierge boutique sort of direct primary care. So for the individual, you pay $60 a month, whether you see them at all or whether you see them 12 times. You pay as a couple $108. Okay, it just comes out of your bank account every month, and you can see them as often or as infrequently as you need. They spend a good 30 to 45 minutes with you. You don't start with a nurse practitioner. You see your doctor right from the start to the end. I've already recommended several people who are very, very happy with this. They are also very, I just said, how do you feel about people's freedom and making their own choices? And they're very free that way. But
what was the name?
It's Monarcha Health.
Monarcha.
Monarcha Health. I should put that in the chat here.
That's awesome. There's more and more private healthcare practitioners. There's a nurse practitioner that just opened up a private clinic in the same building that I'm in. She does dermatology. And I think there's such a high demand for it. I think it's fantastic.
Yeah. So I haven't seen a doctor since 1997, and I got to get myself, I'm referring so many people to this practice that if I don't get myself in there, because I think it's kind of nice to have recordings on you. See, everybody can see my, everyone. Okay. So I'm going to post that. And I had a good half-hour conversation with her. And I said, well, how do you feel like if somebody's like, I won't really talk about COVID, but against a vaccine or whatever. She said, if we think a vaccine would be good, we'd explain that, and that would be your choice. If we think, your cholesterol is high and we want to prescribe a statin drug, if you don't want to do that, we'd say, well, how else would we go about doing that? That kind of thing. That's really what we want, is we want somebody we can call on when we need them. Also, they have a much better system with Quest, right? So Quest is used to getting paid bazillion dollars from insurance, right? So they don't do that. They have a totally different arrangement with Quest. So she goes, what might be $500 from an insurance payer would be like $20, and we just pass that on to you. We don't like charge you over that. So I would say these are the people. There's also one, I can't tell you the name of it right now, but there's one in Peterborough. Direct primary care is what you want to look into, but I can't remember the name of it, but they do take the full family. So from children all the way up, and I can get you guys that information. I think it's really important to have, you know, in this day and age, when you have, maybe you were in a car accident and you have to go to the emergency room or something, to say that you have a doctor, even though you really don't need to see a doctor very often, is probably a good thing to have. And to have people who are like us, but have that medical, you know, they can write prescriptions, they can refer you to a specialist, they can do that kind of thing. I think it's good.
Yeah, before we wrap up, I wanted to say a couple of things. One, there's nothing wrong with having your symptoms suppressed at times. You know, it doesn't make you a bad person. It's like, yeah, I hurt so bad, I need something to get me, to bridge me over. Listen, you know, it's not a bad thing. It's a great service to have. I think the tragedy comes when that's the only option you have, and that there's nothing else you can do. I would also say, you know, trailing on what you said before, like, we'll just do one thing. I think the danger is that people do one thing and then, well, I tried nutrition, it didn't work. Don't drop it out.
Right.
Keep going, add something else to it. Nutrition always works. It's always good to have better nutrition. It worked. Even it might not have fixed your pain or whatever, but it worked. You might need to do other things. So you could add little things at a time, however you want to put it together. And the other just thought that we didn't really talk about it, but I think when you're talking about neuropathy and pain of any kind, you're talking about inflammation. And if there's any one thing that anybody could do that could help their situation, would be to stop eating sugar, because sugar increases inflammation always and always increases pain. So I want to mention that before we wrapped up here.
Yeah.
And that
Did that hurt anybody's
actually,
feelings?
that actually does speak to what I was saying about the glycation, because that's all about the sugar.
Right.
Oh,
Right.
yeah.
Yeah, it's like
And
cholesterol. When people have cholesterol issues, it's not the fats, it's the fat and the sugar together
Mhm.
that get all gooky and sticky, and that's what causes your issues.
Yeah.
Interesting.
Yeah.
One thing I'll add, just kind of specific to Chinese medicine, is that we also look at the environmental influence. So you can have cold that will penetrate into the body and can kind of lodge itself in different areas and joints and things. That's why a lot of arthritic pain is worse with damp weather and cold weather. And so you can use moxibustion, which is a heat therapy, to actually warm up the area and expel the cold. And this actually happened last week in my clinic for the first time in a while, but it's happened before. And when you start doing that with someone, they can feel, even though they have the heat lamp on them. I came into the room later and the lady said, it's so weird. Like, I felt the heat on the outside, but then I started feeling like chilled and cold. And what happens is that cold that is so deep in the body starts to come up and out of the body. So that's really, really cool. But yeah, there's a lot of layers.
My father was, he was a Navy corpsman during the Korean War, and he was actually at the Battle of the Chosin Reservoir, which has been considered by many historians the most horrific battle ever in history, because the temperatures there were like 40 degrees below zero. Wow. And my father, for the rest of his life, was always cold.
Mm.
You know, I think that what you're talking about, like that type of a treatment, might have been really, really good for him. A lot of times we think of cold as being related to thyroid, but not necessarily always.
Yeah, I snowboard and I worked at a ski resort for a year, and I was out on the mountain every single day. And my right big toe, the very first day of the winter for every following year, would get numb that first day and would stay numb for the entire winter. Doesn't happen anymore, but I think I've warmed it up enough. But it's definitely a real thing. It really just lodges in there. Your environment has a big influence on us.
Mm.
Yeah.
Wow. Well, it looks like we are at noon on Friday, September 17th.
Tomorrow is Chiropractic's birthday.
Hey.
Who's
Chiropractic's birthday.
Oh, really?
Yeah, September 18th, 1895 was dubbed the crack that was
Palmer?
heard around the world.
Was that
really.
Dr. Palmer?
Dr. D.D. Palmer, yep, made the first
Yeah.
adjustment. So,
Cool.
so
So that
anyway,
makes
Wow.
it 130,
26
126.
years old.
Nice.
Longer than the AMA. There you go.
So,
Awesome. Well,
anyway,
thank you everyone for listening today.
Joining us.
yeah,
Yep, and have a wonderful weekend, my colleagues there and all of you participating. You can pick this the replay up on our Facebook page and also our YouTube channel. So we'll see you in a couple of weeks. Take care. Thank you.
best.
Bye.
Take care.
Bye.